with the link. So, Doctor, thank you very much. And I'd like to now introduce Danny Martinez from Aurinia.
Good afternoon. My name is Danny Martinez, and I'm the Strategic Alliance Manager with Aurinia. And I'd like to thank, first of all, Lori, Maggie, and Tom of the Lupus Foundation of Northern California for the opportunity to partner with their group and bring this important talk about lupus nephritis. We will have a Q&A session following the presentation, and we'll take as many questions as time allows. And at this time, it is my pleasure to introduce your speaker for this afternoon's program, Dr. Elizabeth Clayton.
And before we start, Dr. Newell, if you could hit stop share on the bottom of your Zoom screen. Perfect. Thank you very much.
Okay. Again, Dr. Clayton is a rheumatologist and managing partner of Rheumatology Associates of Del Mar, VA. Dr. Clayton is a rheumatologist with the University of Maryland Shore Regional Health, Dorchester Eastern University of Maryland Medical System. She received her medical degree from the University of Maryland School of Medicine in Baltimore, Maryland, and completed her residency at University of Maryland Medical Center and served her fellowship at the University of Maryland School of Medicine. Her clinical expertise is in general rheumatology. She's a fellow of American College of Rheumatology and has numerous publications. And with that, Dr. Clayton, you may begin.
I think,
let's see,
Dr. Clayton was going to join us around 2:20, I'm just finding out. So if we want to take a quick break until then.
And I will let her know that to join in right now.
Oh, thank you.
And she's joining now.
Hi there. Sorry. Let me turn my. Hi.
Good afternoon.
How are you?
Good. How are you?
I'm okay. Nice to see you guys.
It's good to see you. Thank you for joining.
I have introduced you already, so you may share your screen.
Great. I'm so sorry about that.
No worries. It's my bad. I thought I told you that it's going to be a little later.
No, so it's okay.
They got that earlier than we thought.
Oh, okay. Yeah. I thought it was happening on at 3:10, but here we are. Okay.
We don't do logistics on Saturdays.
I was going to say it's Saturday, so I apologize to everybody. All right. Well, thank you for the introduction that I missed, Danny. I appreciate that. And thank you all for having me. I'm honored to speak to you guys. This is one of the things I love doing with Aurinia is a lot of the patient advocacy type and education type activities. So today we're going to talk about bringing lupus nephritis out of the shadows. And all of you living with lupus are probably very aware of the big picture of lupus, but I think a lot of the details of lupus nephritis sometimes evade us, both provider-wise, but also patient-wise. So I think it's important we talk about how to identify this. So we skipped my introduction, which Danny already did. So big picture here, I think all of you are aware what lupus is, obviously. This is a serious and chronic disease. It has many complications, many systemic manifestations, and no one lupus patient is the same as another, as you all know. So with lupus, the issue is that the immune system is attacking healthy cells of the body. So it is targeting various tissues and causing inflammation. I think it depends, again, on your individual disease with regard to what manifestations you have. But again, this can cause inflammation various places, right? The common things that we see are skin and joint lupus, and by far and away, those are, in my population at least, the most common manifestations that are seen. But it's important to not forget everything else, right? So we think about the more rare complications. So brain and central nervous system disease, heart disease, lungs, kidney involvement, which we're going to talk about today. So when it affects the kidneys, we call that lupus nephritis. Nephron is the filtering unit of the kidney, right? That is the functional unit microscopically that's helping to filter out the bad things and hold on to the good things. And when we add itis to anything in medicine, it means inflammation, right? So this is inflammation of the nephrons. So lupus with systemic lupus. It will depend on your specific population that you're looking at when you're calculating these statistics. This is about an average. It's higher in certain communities, which we'll talk about. So it is a common complication of lupus, right? The inflammation of the kidneys causes a permanent damage to the nephrons themselves. And you can imagine that over time, your nephrons, your kidneys, just like the rest of you, ages. If you already start out with damage, you're going to age faster as far as your kidneys go than your peers. So your kidneys can't function properly to remove waste and extra fluid. And you can imagine how that can translate long term. There's lots of downstream complications of chronic kidney disease. That can be another talk all in and of itself, but it can lead to kidney failure, which unfortunately may require dialysis or transplant at some point. So I alluded earlier that there are some patients are at higher risk. So who is affected by lupus nephritis? And I think this is really important information to think about where you and your doctor are assessing your individual risk. So there's about 100,000 patients in the US living with lupus nephritis currently. 1 in 3 of those people were diagnosed with nephritis when they were diagnosed with their lupus initially. The other flip side of that is that 2/3 of patients have pre-existing systemic lupus and go on to develop lupus nephritis. So both of those groups, the 1/3 diagnosed with LN on the diagnosis of systemic disease and the 2/3 that are diagnosed later on, you can imagine the hurdles to get to that diagnosis as patients all present differently from each other, right? So if you look in the United States, there's a lot of lupus cohorts that have been looked at from very academic centers. So if you look at racial and ethnicity data, what you're going to see is that comparing populations to white populations, the prevalence is 4 times higher in patients of African or Asian descent and 2 times higher in Hispanic or Native American people. So think about your individual risk with regard to these demographics. So this is a section that I really want you guys to kind of like absorb here, because this is what you're going to have to keep track of in between visits, right? So remember that we as rheumatologists see you guys every couple months, twice a year, what have you, and we see you in a very small snapshot of time, and we rely on you guys to tell us the pertinent stuff. We're going to ask all the questions, but it's important for you in between those visits to keep track of things. So the hard part about diagnosing lupus nephritis is that it can have an inconsistent presentation. So you can present differently than the person sitting beside you. It can also present silently, which is very scary, where you don't have many symptoms, but you have abnormal blood work. So what you can be looking for are swelling in the dependent areas in the legs, feet, or ankles, unintentional weight gain, which is typically fluid retention related. Increase in urination, which is typically noticed overnight. That is because when you start spilling protein into your urine, your body cannot hold on to its blood volume or the plasma of your blood, and you start to have increased fluid that you urinate. That's something that's often subtle, but we have to ask about. And then if you have foamy, bubbly, or frothy urine, that can be a sign of protein as well. The symptoms are sometimes difficult to elicit, or when you're taking a history, because a lot of times, a lot of our patients have other chronic issues going on, and there's other things that can cloudy up this picture, right? Somebody who's on steroids for their joints can certainly have fluid retention from that. So do they have lupus nephritis, or do they have steroid complications? Part of how we distinguish that is with us doing both a physical exam, but also blood work and urine studies. So you want to be looking for protein and blood in the urine. We call that proteinuria and hematuria. Those two things are the hallmark of lupus nephritis, right? Those are two things that should not be passing through the kidneys and making it into the urine. They should be held on to, obviously. You also on blood work are going to look for abnormal electrolytes, for a decrease in filtering rate, which later on we'll talk about what that means. And then increase in creatinine, which is a measure of kidney function as well. And then blood pressure drifting up. And if you have a kidney biopsy, evidence for scarring on a biopsy. So what are the complications related to lupus nephritis? So this is not an exhaustive list, right? Because if we really looked into the data, we could go very long-term down through someone's life who's lived with lupus nephritis and see that there are a lot of downstream effects of this. But in addition to the various signs and symptoms we discussed, you can have an increase in blood pressure that can be challenging to treat. Chronic kidney disease, which is defined as having filtering rates less than 60. We can talk a little bit more about that in a little bit, which indicates scarring of the kidneys. And then cardiovascular complications. Patients with lupus nephritis are at a very high cardiovascular risk, and that is considered, heart attack and stroke risk as well. And then eventually progressing to kidney failure, and unfortunately in some patients, which we call end-stage kidney disease, which can need transplant or dialysis. I think a big take-home point, and you'll see this blue box on the bottom reiterated throughout the presentation, is that this disease state needs to be caught very early. And you can see where that can be challenging, right? Because you have lots of differences in how people present, lots of differences in the risk in a given person. But it's important to know that early detection and intervention with treatment can help to prevent a lot of these long-term complications, right? We want to know if we could, right when someone's developing nephritis, but as soon as we can, so we can treat that and save their functioning kidney. So looking at making a diagnosis here, I think it's an important point to make that the single biggest test that needs to be routinely done, it's not to say it's the only test, but the single most important test is urine testing. And that's because that's going to give you an idea of functionally what the kidney is doing. So it's important to test because you want to see if there's protein and or blood in the urine, which can be an indicator of nephritis, right? Typically, the majority of these patients are going to be screened by rheumatology, unless you're in that 1/3 that is not yet diagnosed on your diagnosis of lupus nephritis. And then you'll need lab orders and to go to the lab to actually do the urine testing. Because the high risk of lupus nephritis for those with lupus, it's important that you have these tests done frequently. So your individual need for screening, meaning how often, depends on your disease, which is, there's multiple factors, right? Antibody status, underlying conditions, what other manifestations you have. It's probably the best for your rheumatologist to determine that, but it can be as frequent as every 3 months, sometimes every month, depending on how sick someone is. And it can be longer than 3 months, but it depends on your specific need. So who commonly us, but I think also it's important to have a multimodal team approach here, and nephrologists are commonly the other people involved. Nephrologists are kidney specialists who treat multiple kidney diseases. They are probably the people that will set up a kidney biopsy and interpret it, and then help your rheumatologist determine the best treatment options for you. Again, we kind of went over some of this already. So there's multiple tests to help diagnose lupus nephritis. So urine and blood are kind of the first test you're going to do, and you're going to do them in screening typically. In your urine, you're looking for how well the kidneys are filtering. Are you spilling abnormal things into the urine, right? So protein and blood. On your blood work, you're going to be looking for various waste products that you should be eliminating, but that can build up. So creatinine is a measure that we use that should be eliminated in the urine, but when it's not, the levels of blood creatinine will rise, and that can be a sign that your kidneys are not filtering properly. And then the most definitive way, and I would say the gold standard way to make a diagnosis of lupus nephritis, is on a kidney biopsy. And this is typically done through interventional radiology with an ultrasound. And you will actually take a specimen of kidney and look at it under the microscope. You're going to look at that microarchitecture to see if those nephrons are healthy and if they're being infiltrated by inflammatory cells or if they look damaged. Kidney biopsies are also vital in that they can help tell you how active somebody's disease is and also how much damage they have. So you can know and have realistic expectations for treating them, whether or not you're going to get things all the way back to normal, in quotes, or the patient's normal, I would say. On a kidney biopsy, you'll also get a grading of the type of lupus nephritis, which can help determine which treatment options are best for that specific patient. On a urinalysis, you're going to look for protein. I've belabored this point on purpose, and that's because it's the single biggest predictor of outcomes in patients with lupus nephritis. So you're going to want to see urine protein less than 0.5 grams or 500 milligrams. If you start drifting up higher than 0.5 grams, that's where you're going to start to have the conversations about, is it time for biopsy? Are there other indicators that are telling us this could be nephritis? And again, same point at the bottom, we want to make sure we know what's going on early so we can intervene early. Once you start drifting to significant protein levels in the urine, there's a high chance that you're going to have irreversible damage to the kidneys. So again, we want to know that and intervene early. The eGFR estimate here. So GFR is a glomerular filtration rate. This is a calculation based on your creatinine levels, which, if you remember, rises when the kidneys don't work properly, your age, your body size, and your gender. And it gives us an idea of your filtering rate. This number tells us how much kidney function you have. So the lower the number, the less your kidneys are functioning like they should. So we typically think of chronic kidney disease, in quotes, being less than a GFR of 60. Most healthy young people are going to have GFRs well above 60. But once you get less than 60, that's when we start calling this chronic kidney disease. Again, this is the reason why we need to identify early so we can keep those GFRs well above 60. So kidney biopsy, again, gold standard here. You are going to confirm a diagnosis after you've had high suspicion, but you're also going to get to know how much damage there is, how much acute inflammation there is, what stage is the person at as far as the type of nephritis they have. It's also important to remember, and this is something that I think gets lost, right? Once you have that diagnosis and you're on treatment for a couple of years, there are a lot of times where we have to rebiopsy patients just so that we know, is there still active disease, or is some of this protein that we have in the urine because we damaged the kidneys years ago with our lupus nephritis? Or depending on your age and your other comorbidities, do you have diabetes? Have you been on a lot of steroids that have caused that? Are there other factors that are starting to affect the kidney? Because a kidney biopsy doesn't just diagnose lupus nephritis. A lot of times we have concomitant disease that we can see as well. And that's helpful to know, right? Because the last thing you want to do is immunosuppress somebody for kidney issues that are not related to nephritis, right? So managing lupus nephritis is very multifocal here, right? So the classic treatment is initially steroids, which are kind of the cleanup man, right? I always tell patients they're the acute warriors that we're giving. They go out and they clean up the mess. But what they don't do is actually stop the disease process, right? They might clean up the end outcome, but immunosuppressants work multiple steps back in the chain to stop that inflammatory response from sending out the inflammation. So most patients are going to need both things. There's also commonly used blood pressure medications that are very, very frequently used in lupus nephritis to help lower protein, but also control blood pressure, which can be challenging. And then our anti-malarials, which is hydroxychloroquine for most of you guys, is a very classic group of medicines that is used not just for treatment of SLE, but has been shown to be beneficial in those patients with lupus nephritis as well. So again, it's important to know you're not going to be on one medicine that doesn't exist currently. I don't know that it ever will, but you are going to be on usually a cocktail of medications depending on what your underlying disease needs. So living with lupus nephritis, so again, we want early detection and we want early intervention and all of this. But I think something that is really important that in our practice, we really stress to patients is being your own advocate and being active in your healthcare. I would say the vast majority of my lupus patients are already like that before I have that talk with them. And that's because a lot of you guys have chronic disease, right? You're used to living with chronic disease and you're used to managing a healthcare system that is no secret, that is very challenging and broken in a lot of ways. So I think you're the best person to be advocating for yourself. Make sure that you work with your whole healthcare team, right? Which, as you'll see in a little bit, can be various doctors and various specialties. Keep learning, keep educating yourself. Programs like this and health summits and such are vital, right? That's how you're going to be the best advocate. And then diet and exercise, healthy living overall, mindfulness, which is not on here, all really important parts of healthcare. So who can potentially be involved in your lupus healthcare team? I think this is not an exhaustive list on the right. There are a lot of providers involved in caring for patients with multi-system diseases, which is essentially what rheumatology does. But we also know very well that we need help, right? So nephrology is the main thing when it comes to lupus nephritis, but a lot of patients have skin disease and have a dermatologist that's actively working with them. A lot of our medicines can cause neurologic issues, or patients can have CNS, central nervous system lupus, and they'll need neurology, cardiology, pulmonology. All of these subspecialties are important, and it's important that your doctors are coordinating their care. There's also people behind the scenes that you'll never see, right? You'll never see pathology, radiology. You'll sometimes see the pharmacist, but a lot of those conversations get had between the various healthcare providers. And then PT if there's musculoskeletal issues. I think something that's always lost in this among the specialists that talk to each other is primary care providers. God bless them for all they do for us. But it's important to note that rheumatologists sometimes become the lupus patient's primary care just by the nature of how aggressive and multi-system the disease is. But I think primary care is such a vital role that gets lost in the midst of this. And I think we need to make sure that we're all, and you guys are all engaging with them. Sometimes we can get dietary and nutritionists involved. We have a hard time in our area with that. I'm hopeful your area is better. And then psychologists, therapists, any mental health stuff that pops up, all of that as being part of the treatment team. So just remember that it is a team approach. So again, there's multiple plugs throughout this entire program about being a self-advocate. And I think that is a huge take-home point here, right? Keeping track of appointments, hospital visits, anything that happens in between visits, we often forget about, right? Just remember that we don't have a seamless healthcare system. Everything doesn't magically appear at all your doctor's separate electronic medical records. So a lot of that you have to tell us about. Make sure you're keeping symptom logs. That's something that is really important. It might seem burdensome to you, and sometimes it can be overwhelming for the healthcare providers involved, but it's really important because sometimes there's stuff we are noticing on there that you would have never thought about as being relevant that we see and we're like, oh, wait a minute, this is abnormal, or this is not something I would expect. I always tell patients to keep binders of all of their labs and imaging. Yeah, we all have portal logins, which is excellent, right? You can look at things graphically represented and you can look at long trends over time. But when you're seeing a new doctor or you're transitioning care, let's say to a new rheumatologist, it's really helpful for you to have that stuff because sometimes there are barriers for us getting those results. Make sure you're letting your doctor know about all of your medications. A pet peeve of mine is knowing about non-prescribed things, right? Over-the-counter things, vitamins, supplements, even dietary stuff that people are doing or protein powders and stuff. It's important to disclose all of that. Take somebody with you. If you're gonna have a big conversation with your rheumatologist or your nephrologist about what your biopsy looked like and what your treatment options should be, it is really overwhelming. No, there's no secret to that, right? It's a hard conversation. You're talking about lots of medicines, lots of possible side effects. It's important to have that second person there that's absorbing as well. And then don't ever assume there's dumb questions. There are never dumb questions when it comes to your health. So ask anything that's going to make things clear for you. I think the blue box on the bottom is very depressing for a lot of us in healthcare. So in so many ways, the pandemic brought us together, right? We're having more virtual conferences like this. We're having telemedicine visits. But in a lot of ways, it was scary enough that we lost patients and patients were lost to us and we were lost to them in a lot of ways. So make sure you stay plugged in with your healthcare team as well. So telemedicine is a great option. I'm not sure what your coverage is like in your area. In our area, we do have some limitations with some of the insurances, unfortunately. So it's important, if you can do telemedicine, make sure you're ready for the appointment, be efficient, just like an in-office appointment, right? Have your questions ready. I have patients send us their symptom logs ahead of time, or their blood pressure logs ahead of time, so we can see them, so we're not doing the hold it up to the screen business. Use your chat option through your patient portals with your various providers. I know sometimes it's hard because some of us are on different medical records than others, but if you have the opportunity to have group chat with people on your patient portals, definitely engage in that. Make sure you're able to show the physical symptoms if you do. If you have swelling in your feet, make sure you can show them on telemedicine or take pictures of things ahead of time. I have lots of patients document rashes with lupus, just so I can make sure before getting them in to see me, if it doesn't look like lupus, if it looks like shingles or something more acute that I need to treat, before making them wait a couple days to get in with us. Do your labs ahead of time. That's another great asset, right? You can talk about them at the visit rather than there being a phone call after the fact. And then you should be checking your vitals at home ahead of time, right? And get those numbers to your doctor ahead of your visit. I don't have to say the bottom point, which is to make sure you're keeping up with your healthcare providers. If you're attending a summit like this, I'm pretty sure you're probably engaged in your own healthcare. So looking beyond medications, a lot of the dietary and exercise recommendations are going to depend on your specific case, right? So again, these are big, broad strokes recommendations. I would recommend that you are engaging with your healthcare provider for what's right for you. But anybody who has kidney disease, we're going to advise for a lower salt or sodium diet. The reason for that is you can overwhelm the kidney's filtering mechanism, and some of the sodium balance can be offset such that you start to have retention of fluid with a lot of sodium intake. Avoiding processed foods. Part of that's because we just don't know what's in them chemically as part of some of the preservatives that we have, right? We have these discussions all the time about antibiotics in our meats and all this kind of stuff. We just don't know what those things are going to do long term, so we don't want to take risks. Depending on how bad kidney function is, you might have to adjust how much protein you're taking in, because sometimes that too can overwhelm the kidney itself. And then choosing heart healthy options, right? Kind of eating more fruits and vegetables than you're eating processed carbohydrates and things like that. Talk to your diet or your doctor specifically about your diet changes before making any. And then exercise is the same way, right? There's a lot of data looking at lupus patients and outcomes as far as exercise goes. And there are innumerable emotional and physical benefits. There's also innumerable barriers, right? Because there are a lot of musculoskeletal complaints in lupus. And that does make engaging in physical activity hard. But I always tell patients it does not have to be anything fancy, right? You don't need some huge piece of equipment or expensive, videos to do anything. Get moving, stay active. Swimming and walking are easy ways to get involved. And if you can only do 3 minutes of walking, start at 3 minutes and start pushing that higher and higher as far as the time you're doing. Stretching is super important. And then really non-impact things like yoga, Pilates, those are excellent as well. I also tell people to use exercise equipment only if they can. You don't need it, honestly. I have a lot of people look online on YouTube and these various platforms for yoga, and you can even look up things like yoga for lupus or yoga for knee pain, things that are not high impact, but that are going to be high yield long term. And make sure your doctor's on board with whatever you're doing. Again, to belabor the point, you are your best advocate. You are probably your own advocate in some healthcare settings. So make sure that you're staying involved in your own care. I think it's important we talked about this a little bit a couple slides ago, making sure that you're keeping a list as your interval between your visits goes, keeping a list all along of things to ask, right? Inevitably, you'll get into that doctor's visit and we have 20 minutes together and you will forget 50% of what you intended to ask. So just write it down. Stay up on your urine test, your lab work. What is the trend looking like? Do I have kidney damage? And do I have a risk for long-term complications? What's the extent of that damage? And kind of, is there a way to tell how severe this could get at some point? A lot of these questions are hard to answer, but there are scenarios where we can look at patients' biopsies and antibody profiles and response to therapy to get an idea of long-term how they're going to do. And then asking the really long-term stuff. What kind of challenges do I expect? How can I prepare ahead for them? How can I avoid them? I think are all really pertinent questions. So again, make sure that you're staying engaged, staying informed all along the way, right? know that 50% of patients with systemic lupus can go on to develop lupus nephritis. Know what the symptoms are, like we talked about. Make sure that depending on what your needs are with your lupus, you're being screened appropriately. And make sure you discuss your options, right? So it is important to have an early diagnosis and an early intervention. Delaying that for any reason can be harmful long-term for your kidneys and for you overall. And remember, as you guys probably all know, early diagnosis and treatment is the most important thing, but this is not a one-size-fits-all disease, right? So I always say, you know, you take 5 people sitting at a table who have lupus, and they're all going to have different stories and different presentations, and sometimes different treatments that work for them differently than their neighbor did. So I think that's important to know too. Continue to learn, right? Continue to engage in educational activities. We can get involved in the All-In program here, like we'll talk about in a few, and be involved, right? Be your own advocate, be your own disease's advocate in a lot of ways. So I'm gonna turn it over to Danny to talk about the All-In for Lupus Nephritis program.
Thank you, Dr. Clayton. So let's talk about the All-In program now. So Aurinia created the All-In program with insights from lupus nephritis community to support earlier diagnosis of lupus nephritis and allow people living with lupus and those with lupus nephritis to have informed discussions about lupus nephritis with their healthcare professionals. So All-In is an educational and support awareness program focused on the diagnosis of lupus nephritis, living with and empowerment and support of the people affected by lupus nephritis through information, tools, and resources. All the people you see here on the slides actually are all people living with or showing signs of lupus nephritis and their care partners. The All-In program website offers information and signs and symptoms of lupus nephritis, diagnosis of the disease, as well as tips for managing lupus nephritis once diagnosed. You can hear directly from the people living with lupus nephritis who share their personal journeys, including the challenges and the triumphs and the community support, videos, and personal stories section of the website. Next slide. So to help awareness of the lupus nephritis and to empower those living with the condition, All-In has created a lupus nephritis awareness kit you can see on the left, and with insights from members of the lupus nephritis and lupus communities. Inside the kit, you will find resources to help increase your understanding of lupus nephritis, along with the tips to help manage your disease. So you can register for the All-In community by clicking on the Register Now button at the bottom of the page of the Register Now, or at the top of the page. The kit shows here will be mailed to the address you will provide. So members of the All-In community also receive seasonal e-newsletters like the ones shown here with the updates on events happening in the community, new information about lupus nephritis, and health and wellness tips, including kidney-friendly recipes. Next slide. And so these are all the website that you will find on the All-In community. You'll see the allincommunity.com, ln.com. And then we are also on Facebook. You can click on that. And then, of course, join the All-In LN program to register on the website. And that should be it. So, Tom, would you like to open up for Q&A?
Yeah, first, Danny, that was great. Thank you very much. Dr. Clayton, that was very interesting and very informative. Thanks. And as Danny said, we're going to open up Q&A. I'll begin with the question that came in during the presentation, and then if there's any more, please put them in the Q&A window on Zoom, and we'll answer those. The question that came in, Dr. Clayton, was coordination of care has been an issue for us. Who do you recommend be the quarterback for this?
I'm biased because I'm a rheumatologist, but I think it should be a rheumatologist. It's really hard when you have multi-system disease and you have that list of specialists involved. You know, you have 5 or 6 people, and the primary care provider always gets left out of everything, unfortunately. But it probably should be a rheumatologist. If you have multi-system disease or if you have nephritis specifically, usually it's rheum. I think that's the most appropriate.
Thank you. There's another question actually around protein-rich meals. In one of your slides, you had said eat small portions of protein-rich. Is that animal protein you're trying to restrict? Or is it?
That's a good question. I've always thought of it as animal protein, but in today's world of supplements and such, I think it's any protein in general, whey protein included probably. I would say that is a specific recommendation for depending on how bad renal function is. We're not typically restricting people who have very mild disease. It's when you have advanced chronic kidney disease that becomes very relevant. But yeah, I think it's any dietary protein. Including
plant-based.
I would assume, but I would have to tell you that that's a nephrology question. So okay. I defer the ultimate answer of that. We don't have a nephrologist on the call to pick their brain.
Nope, that's fine. Are there any other questions from the audience for Dr. Clayton or for Danny about the program?
Hey, Tom, just for the interest of the attendees, one of the things that a lot of patients miss is submitting their urine test for every 3 months. And so, Dr. Clayton, how would you, if that rheumatologist has not personally offered this to their patients, would you recommend these patients be proactive about telling their doctors to submit their urine?
I think it's really important to have the conversation about what your needs are with lupus nephritis. I do have lupus patients, chronic systemic patients who do not have nephritis, who because of their disease type or their antibody status, they don't need every 3 months screening, they get 6 months screening or what have you. I think it's important to have the conversation with what a specific patient's needs are. And again, I mean, I think you can always, urine test is easy enough to request. I think you can always request it too. And I will tell you, your rheumatologist will probably feel relieved that you're educated about this and that you're on top of things, because so much of what we do is education in the exam room. And you know how hard that is when you're limited for time and you have multiple things you're discussing that are going on. I think it's important, you certainly bring that up and see what your needs are.
Dr. Clayton, as just as a common occurrence in a doctor's office, I've seen this with my kids, myself. Sometimes there are, common questions that people are just, lupus patients are just embarrassed to ask, or what's the advice you'd give them?
So I think so much of your relationship with your doctor is rapport driven. And I think you have to be, granted, I don't know what your area is like, but we are limited in our area as far as, the country's limited with rheumatologists anyway, right? It's only going to get worse as time goes on, but we are limited, right? So I think recognizing how comfortable you are, you should be comfortable with your provider. And even if you have limited resources, you should find somebody that you feel like you can have those conversations with. We have lots of uncomfortable conversations that are usually uncomfortable for patients. They're not really for us. Just remember, anything you ask us, any body part we're looking at, we've done this 1,000 times before. And, we are not mortified by anything people are going to ask, honestly. I would just go into it with that attitude, but I also think you have to be comfortable with your provider. You want that person to foster an environment where you can send a message over the portal asking about complications of a medication that are embarrassing, or having the conversation with the nurse on the phone about what's going on. I think you got to feel comfortable in your treatment environment, but also just remember, we have seen it all and talked about it all. Nothing, I always joke with, especially the lupus patients, because they always have so much stuff going on. Nothing shocks me anymore, honestly. Just ask it, get it out there. You need to be your own advocate.
It's a great answer. Any other questions from the audience before we wrap up today? Okay, I'm not seeing any come through. If questions do come through, we'll respond in email to you. But Danny, thank you for the discussion of the All-In program. And Dr. Clayton, thank you for a great session. That we really appreciate your time and expertise. I hope that everyone learned something new today. I know I did. Again, if you want to rewatch this video, or if you missed Dr. Newalt's presentation from earlier this morning, it'll be available on demand next week. So please watch for an email with the link. Please be sure to take the survey you'll receive via email. This is going to help us find topics that are interesting to you and how we can improve in delivering these conferences. So again, thank you all very, very much. Final note, we have another virtual health conference scheduled for April 29th. This conference will focus on lupus in adolescents and teens, as well as discussion about the posterity clinical trials for young people with lupus nephritis. You can sign up for that at our website at lfnc.org/events. And of course, for additional resources or questions, please visit our website at lfnc.org or email us at communications@lfnc.org. I've always hated those people that just keep saying that over and over again. Now I've become one. I hope you all had a good day today and that you'll join us for other lupus health fair conferences this year. Watch our social media, website, or emails for more information. Thank you for joining us today, and I hope you have a great rest of your weekend. Thank you all. Bye-bye.